Hi, at MCTA Eric here today, and we're going to be discussing some rotational mobilization with movement with the Mulligan concept at the elbow. Had some questions come up on social media about this one and what we're trying to achieve. So the elbow, designated as a hinge joint, has a z-axis of rotation that we need to consider with our forces that we can put around the elbow. So if you have a comparable sign of loss of motion or pain at the elbow, you might try rotational forces. So the key with these rotational forces is to lock out the soft tissue. So we're going to put my fingers underneath the ulna and have it on the lateral aspect of the ulna to create a lateral force with my rotation. But if I don't do a good job of locking out the tissues, I can get glenohumeral motion along with that. So in this case, our scenario that we've created with Megan is a painful extension or maybe a loss of motion. So she goes through that and she reports her comparable sign. I'm going to do the rotational lock medially above the joint first, and that will allow me an easier time doing a rotational lock for lateral rotation of the ulna below the joint. I hold onto that force and have the patient move. She should be able to extend her elbow, and we monitor reports of pain or increased motion. If she has pain, then we adjust our forces, or we change up our technique and what we're doing with that. We can also use a motion guidance contact pad, which is a hygienic pad that we can wash after we're done. It allows for a grippy surface that also softens up my contacts, and this will easily help lock in that connective tissue for the fascial lock and make my work even less hard to do this mobilization. So now try extending. Beautiful. Any pain? Good. And we go through repetitions, several groups of however many it takes. Thank you. Hopefully this adds some clarification to some of the techniques that we discussed today. I hope to see you next time and on future techniques and videos.